Rectal bleeding is very common, and the first thing to say is that it's most often not a representation of something more sinister. So there are lots of people who have a little bit of blood when they wipe themselves after going to the toilet from minor trauma to the back passage during defecation. I think it is also a symptom potentially of something more serious, and it is said that blood that is fresh and bright red and on the paper when wiping or splattered in the pan is a sign of not being anything sinister, but most likely being from an anal cause, such as a fissure, hemorrhoids, or other cause. Blood which is darker in nature or stickier in nature can be a sign of bleeding from something higher up around the bowel, and does have a certain connotation that there might be something more sinister present. In the UK at the moment, we use fecal blood testing to screen patients of a certain age to see whether there's blood actually in the stool, and we get a quantitative measure of this. It's called a FIT test, and if the FIT test is less than normally 10, it's fine, and if it's higher, it can be a sign of something further around the system. So the answer is that in most patients, rectal bleeding does not represent anything sinister, but it is a sign in some, and therefore it should be treated seriously, and advice should be sought if a patient notices rectal bleeding. I think the short answer is it is unlikely that those are factors in rectal bleeding. Stress can, of course, exacerbate any symptoms in the body. I don't believe that COVID is a cause of rectal bleeding per se. So I think the answer to your question is not really. As I alluded to previously, it is said that fresh, bright red blood is a sign of not being anything sinister, of minor anal trauma, either of hemorrhoids or of a fissure. Dark blood can be a sign of something untoward further around the system. And the reason is that as blood goes around the colon, the bacteria and enzymes in the colon change its color from the fresh blood when it comes out, such that as it travels around the colon, it turns to a more darker, browner, blackish color when it comes out of the tail eventually. So bleeding from the right side of the colon, whilst it's fresh when it starts, by the time it comes out of the back passage will be a much darker color. So there is some worth in checking to see how fresh or otherwise the blood is in patients who have rectal bleeding. Most patients who have minor causes of rectal bleeding, which are by far the majority, the symptoms wax and wane. So they will have bad weeks and good weeks when they notice the bleeding, and then they may have several months off before the bleeding then starts again. So it can be very intermittent. And indeed, that's often a good sign if they have fresh bleeding that is very intermittent, is classic of minor anal canal pathologies such as hemorrhoids or fissures. I think if you are a patient who has repeated rectal bleeding, if it is dark in nature, if you have a family history of sinister bowel pathology, or if you're worried in any way, you should go and see a doctor. And you can have, as I've alluded to previously, a test to see whether the blood is actually in the feces themselves. And it may be that you'll be needed to refer or to a specialist for further investigation to decide whether the bleeding is of significance or not. So the most likely thing that a specialist will perform when presented with a patient who has rectal bleeding is they will take a history from the patient of the bleeding itself, of the family history, of the bowel habit, of how hard the stools are, when the bleeding's worse, when it's better. And then they will examine the patient, and a simple digital examination of the patient can be very helpful, along with simple examination inside the patient's back passage with an instrument known as a proctoscope, which will tell you if the patient has significant hemorrhoidal disease, which may account for the bleeding or not. Normally, in a patient who is in middle life or older, the specialist may want further investigation, which will take the form either of direct visualization of the inside of the bowel using a colonoscope, or it can be done with radiology such as virtual colonoscopy using a CT scanner. And these are the main modalities for assessing whether there's anything important or sinister as a cause for the bleeding.